Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Jennifer Shaer. She's a pediatrician and chief wellness officer at the Allied Physicians Group. We're going to talk about her Kevin MD article, The Holidays Can Open Up a Range of Emotions. Jennifer, welcome to the show.
Thanks so much for having me, Kevin.
So we'll get into your article in a little bit, but first off, briefly share your story and journey to where you are today.
So I am a pediatrician. I've been a pediatrician for 20 plus years. And when I think about sort of my journey of how I got from there to here, so to speak, it's funny because I think about that I didn't necessarily ever want to be a doctor. I was one of those kids, a science math kid, and becoming a doctor was sort of the path of least resistance, actually. My mother was always kind of pressuring me, be a doctor. And so that certainly made me not want to be a doctor. But, I went to school and I studied biology. And what the heck else do you do with a biology degree when there's no good ideas for careers other than being a doctor? So I went ahead, I became a doctor, and I have no regrets. I mean, I love what I do. I chose pediatrics, and after becoming a pediatrician, I had a little bit of a meandering course at the beginning and ultimately decided to go into outpatient private practice. I had an amazing opportunity in that my father-in-law was a retiring pediatrician and was begging me to take over his practice. So I ultimately called a friend from residency and said, let's do this. And we took over his practice and started going. And we really, really felt connected to the community, but quickly realized that there's so much more to practicing medicine. So we rolled our practice into Allied Physicians Group, which allowed us, it's like a group without walls in a sense, and it gave us the backdrop, the support of the IT and all the infrastructure that we needed so that we could sort of, on the front end, be the general pediatricians in the local community, on the back end, have the support of a big company. And from there, I got very active in the company. I became part of the board of directors, became the chief medical officer, and then ultimately this chief wellness officer. And part of my time now is I see patients part-time. I'm this chief wellness officer part-time. And then I'm also a coach for mid-career pediatricians who are sort of burned out and looking to either save their career or create a new one. And that's where I am so far.
So tell us more about being a chief wellness officer, a little bit more about that role.
Yeah, so the role of the chief wellness officer is to really prioritize, make wellness as important to the company culture as is, quality and all of the traditional things that healthcare systems are focused on. Because the physician well-being is really the secret sauce to success of a medical group. And having an executive level person focused on that, not only supporting the well-being of the doctors, but also being the voice for when a policy is coming up. How is that, what can we do to make things easier? Where can we, make things better? And it's really amazing to have a company that's supportive of that role. It's not too many companies that do that. So
yeah, so one of the things that you said really resonated is that one of the main missions of your job as a chief wellness officer is to make clinician wellness as important as some of the other measures that the company may be interested in. Can you give us an example, share a story or a case study of how exactly you've done that within your company?
Sure. So this is a brand new position, so I'm very excited. It's January 1st. So, but right off the bat, my first project has been to sort of take the pain point. What's my personal, I still see patients, so I'm kind of in it, deep in it. And for me, it's charting. It's all of the charting. So we're in the midst of a scribe pilot. Good. Where we're testing out different scribe companies. And already, I mean, one of my clinicians who's starting it, she said, I feel liberated. It's just, so that type of a thing where the burden of charting is really just making the doctors feel so.
All right. So let's talk about your Kevin MD article that was written in December. It's titled, The Holidays Can Open Up a Range of Emotions. Now, how did this article come together?
a couple things were happening at the time. I mean, for starters, the amount of anxiety and depression that I see in my patients in and of themselves, I mean, it's staggering. And pediatrics has moved from sore throats and earaches over to, anxiety, depression, and ADHD. It's really
Yeah.
completely changed. And there's just so much talk about burnout in physicians. I didn't realize, I think right around the time I wrote this article, I saw something about National Physician Suicide Awareness Day.
Hmm.
And I didn't even know that existed. And I think it's sort of horrifying that we have to have a day like that. But at the same time, my sister actually told me about something tragic, which was one of her friends. He lost his daughter, who was a pediatric resident, to suicide. And so those two things together, along with, I don't know exactly where I saw the story about the happiest countries having the highest
Yeah.
suicide rates. It kind of those three things together, and then the article just sort of wrote itself.
Sure, sure. So I think it was mentioned the World Happiness Report, right? A connection between happiness and suicide rates in
Right.
Scandinavian countries.
Right. This sort of inverse relationship. Like if you're surrounded by happy people and you don't feel so happy, you feel even worse about yourself.
Yeah, so talk about that. Like, why is it harder to be sad when everyone around you is happy? And how does that affect mental health?
Yeah. So when you have this like dissonance with what you're feeling and what you think you should be feeling, it almost adds suffering to the pain. So, your dog dies, you're going to feel sad. That's normal to feel sad. That makes sense. But if you're at a holiday party and everybody's happy and you're feeling down, it's more than just the feelings of being down. It's that you should be happy. And that just
Mm.
adds, like I said, that second layer of suffering.
How can you stop comparing yourself, kind of breaking away from that mindset, especially during the holidays, because there's so many holiday parties, everyone in general is happy. What kind of recommendations can you give to break away from that mindset of comparing?
Yeah. So first, I like to point out that it's normal to compare. We sort of come from this evolutionary history of needing to fit in and, be part of the clan and want to be liked. And so it's our human nature to compare and want to be normal. So at least you can give yourself a little bit of a break and not judge yourself so much for feeling that way. And there's other things. It's like you're making connections with other people, and sort of feeling a connection can help you a little bit. And also realizing that everybody, I think I made a comment in the article about how, it's the Facebook world, where
Hmm.
everybody's
Hmm.
life seems so much better than it necessarily is. Like everybody maybe seems happy, but maybe they're not quite as happy as they seem. So
Sure, sure, sure. Now, talk about, like, I guess, vulnerability. Like, sometimes it's very difficult to open up about
uh,
these feelings, especially during the holidays. So,
mhm,
how can one go about doing that?
for sure. And I think you hit on something huge, which is emotions and vulnerability in general. It is so scary to feel your emotions, but unless you're going to sit quietly in the cave and stay safe, in order to do anything in life, there has to be discomfort. It's almost
Mm.
like, what do they say? I don't know who said this, but discomfort, it's like the currency of growth. You
Mm.
have to go through discomfort in order to like the caterpillar becoming the butterfly, right? I'm sure that's not a very comfortable process. So being vulnerable to let somebody in and know how you feel might be painful, but on the other end of it, it's the delayed gratification of where you're going to get.
So, I like that discomfort is the catalyst of growth. Is that something you've
Yeah.
heard, or did you come up with that yourself? Because I
No,
like
I've
to quote
definitely
that.
heard that somewhere. I don't know exactly where.
Now, like, as one strives to be vulnerable or be comfortable with vulnerability, especially during the holidays, talk about the role of support systems, family, friends, or even someone professional.
Right. So the when you're feeling down and you have your support system, so I always want to point out just for a second that there's a normalcy to the ups and downs of emotions, but the serious like depression, and when you really sort of get stuck and there are no ups and downs, it's just down and more down, then you have to, use a light, reach out for a lifeline. And I always really want the people who are feeling good to have sort of a little bit of an antenna, to be on the lookout for people in their lives who might be feeling a little bit down, because it's harder for the person who is in that weakened state to reach out. So if those who are feeling good can pull up. But yeah, when you're feeling down, just sending a text to somebody or just forcing yourself to go out and make a connection. Humans need human connection. And during COVID, we all lost it.
How about seeking behavioral health help? Sometimes it's very difficult. There's not a lot of access to mental health specialists. So, during times when everyone around you is happy, especially during the holidays, talk about potentially reaching out for behavioral health help, some professional help, especially when access is so limited.
Yeah. I mean, there are lots of resources if you're, willing to just, there's the new, was it 988? The new support line. There's all sorts of like text lines and emergency type resources. What's a little bit more challenging is finding consistent therapy from somebody. But honestly, it's mostly challenging for people who don't have money. If you have money, you can pretty much find what you need. It's going through insurance, and this is the challenge for our patients. If you have Medicaid, it's very, very challenging to get good mental health support. But when you have private insurance or you have the means, you can pretty much find it. And there are all sorts of platforms now that match therapists through insurance, third-party platforms and things. So I don't know. And I think that it's such a public health crisis that more money is going towards it. So I'm hopeful that there'll be more access for people.
So what are some red flags that people should look out for that may necessitate them to seek, behavioral health help, medications? What are some red flags that they should look out for in order to take those next steps?
Yeah. I mean, if you're thinking about yourself, again, I always have the mindset of, am I talking about myself and my colleagues or my patients, right? But in general, it's when your mood has gotten so low that you're not able to meet your activities of daily living, so to speak, right? So you're having trouble getting out of bed, or you're not eating well, you're not sleeping well, and you're not feeling happy when you're in happy situations. You have that incongruent sort of feeling. I thankfully don't personally suffer from depression, so I don't know exactly how it feels, but people have told me, I mean, I have plenty of anxiety, but no depression. The depression, they feel like a physical, like they say they feel like a physical heaviness to them. So
we're talking to Jennifer Shaer. She's a pediatrician and chief wellness officer of the Allied Physicians Group. Her Kevin MD article, which we're talking about today, is The Holidays Can Open Up a Range of Emotions. So Jennifer, as one approaches the holidays and know that they historically perhaps have felt negative feelings after comparing themselves with people around them who may be happy, is there anything people can do to prepare themselves mentally as holidays approach?
Yeah, I love that question, because as a pediatrician, I am all about prevention. For me, prevention is the secret sauce, the best thing. And I wish that I had learned back in med school that there is actually preventive care for your emotional well-being. We all talk about diet and exercise, but there are lots of things that you can do to build up your emotional sort of strength. And there's mindfulness and meditation and resilience building practices that you can do, so that once you are set with the difficult situation, because bad things are going to happen, but if you have that sort of muscle sort of built up, then you can get through it much, much easier. So I would say that's kind of the long game. Practice that. And if I could scream that message out to the children and to everybody when they're young, they will be much better to handle things in general, because it's really hard to manage it when you're in the middle of it.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
That probably would be my biggest take-home message. It's about listening to first of all, having the intuition to check in with your feelings and know what you're feeling, and to prioritize your emotional well-being as well as, it's not always trying to worry about the world around you, but looking inward.
Jennifer, thank you so much for sharing your time and insight, and thanks again for coming on the show.
Thanks for having me.